Again, he has been with us before, and we're delighted. And a big Healing Our Earth community global welcome to Dr. Rajeev Gupta. For those of you who may have not encountered Dr. Rajeev Gupta, Dr. Rajeev Gupta is medically qualified consultant in the NHS for the past 17 plus years and is chairman of the Central Specialist Advisory Committee of the Royal College in London. He's also been the chairman of regional council in the BMA, British Medical Association, for 5 years, and is currently the chairman of the regional consultant committee for Yorkshire. I'm delighted because he's also an active researcher and has been the chief investigator and UK coordinator for international research trials. He's also received many awards, including clinical awards, Glory of India Award. I was fascinated to hear about that. Outstanding Personal Service Award, Heart Award, and the Gold Award for Health Workplace. On top of all these accomplishments, Rajeev has an active interest in yoga and has been tasked by Swami Ramdev, the well-known world authority in yoga, Sri Swami Ramdev ji himself, to lead medical advisory committees and actively help integrate yoga into medical practice in the UK. And so since I believe you've set up a teaching yoga practice to doctors and run many yoga teaching sessions for doctors, especially for doctors around the UK, and you've done a lot to study and bring forward the benefits of yoga into the medical and contemporary workplace. We're honored to have you, Dr. Rajeev Gupta. Welcome. Healing Our Earth says namaste to you.
Thank you so much, Pras, for such a kind introduction. And I'm so delighted to be part of the Healing the Earth community. I was here talking earlier and I'm talking again now. I feel like I'm connected to the people who are working in the same direction for the same purpose and the same goal. And therefore, my task is made much easier. The way people have spoken throughout the day, it has been really, really enjoyable journey. Beatrice.
Actually, I'm excited to hear more. I may ask you one favor. Rajesh ji, just raise your voice or come closer to the mic for us.
Is it better now, Rash?
Yes, there we go. Thank you, Rajeev ji.
Oh, so you might see a bit more of my nose than my eyes, but that's okay. Just give me 1 second. Let me try if I can get that there. Is that better?
Yes, you're clearer and louder.
Cool. So saying all that, my job has been made easier by a wonderful session done by Beatrice, and that shows the power of yoga. And we have heard previously from Dr. Pankania that coronavirus is here to stay, pandemic, and is likely to be endemic, which basically means it's going to be here. We know that nearly 290,000 people have been affected by corona, and 45,000 people have died by COVID-19. This is unprecedented. It has never happened before. And I think it's so important that we get it right. Sorry, let me move it back. I can see better now. So one thing very important for us to know that, as Dr. Pakhania said, there is no treatment. If steroids are given, dexamethasone is going to be helpful if you are on ventilator or have a severe respiratory disease. There is not a lot of hope from Remdesivir. Hydrochloroquine, not much hope. And anything else that has been proposed has not been really much useful, including the azithromycin. And he was saying that vaccine may or may not give a good hope because there are so many proteins in the virus. And as you know that it's a ball-like virus, and there are all spikes, and these spikes enter into the respiratory tract, and each spike works like a key. It opens the key, opens the lock, go into respiratory tract, and then cause cytokine storm. And that cytokine storm is what is the biggest problem. So the question is, what can we do about it? So one thing is we can sit tight. First thing we are doing is keeping distancing, but there is a lot more we can do. And I'm trying to have a bit different aspect to the life, which is what I have learned over the last several years. As Prash was telling that I have been studying yoga and looking into the scientific basis for yoga, because a lot has been said and people here, they become yoga teacher, they start teaching it without knowing the whole scientific basis, the physiology and the mechanism of action of each pranayam and asana. And if you understand it, you will be able to do it much better. So let me try, if I can, share my screen. And here we go. Can you see something? Prash? It's visible. Cool. So as I was saying that such a, basically we need to know there is one thing that connect all of us, and that is the pran vayu, the vital air. And that is the air that goes in and out of us. And that is what sparked my interest in yoga. And that is of three main types. First is pran, second is apan, and third is udan. And all these, the top one is heart and lungs, then the tummy, and then rest is the food pipe. So all systems are united through this, and that is there. And whether we accept it or not, although there is, you can put the person on ventilator, it carries on so long and then dies. What happens? You are pumping air through the ventilator into it. You can pump adrenaline, you can pump anything to keep the heart working, you can keep the lungs working, but what is missing is the pran, which is the vitality, and that's what you can't start. Having done like years, 27 years into the medical science, doing various degrees and being the chief investigator, doing a lot of research, I have come to know that we need to understand the fundamentals. And we know now this global pandemic and high infection rate with high mortality, we need to find a different way because there's no definite treatment. And one of the possibility, and I'm not saying that is the only possibility, is simple, easy, and free, and that's yoga. Yoga has got three main stems. One is stretch and restorative poses, which is asana. Second is breathing exercise, pranayam. And third is meditation, which is you're connecting to your inner self. And when you're connecting to inner self, then you know what's happening to you. Now, the benefits of yoga are immense, because more I read about it, more I learn about it, more I convince myself it's very useful. We know that if you're taking a deep breath in and there is a deep breath out, you are increasing the oxygen intake. And that oxygen intake, when it's delivered to tissue and organ, is going to increase the organ vitality. Also, it's stimulating the lymphatic system when you are doing various asanas. And it's also removing the anabolic and metabolic products which are collected into the body, including the lactic acid, etc. And then it's also improving the immune system. There is a lot of research that is done which shows it increase the natural killer cells, and that is the T cell immunity, and that's really, really powerful. The second part, in addition to the physical health, is the mental health, which is very known. 6 out of 100 anxiety, 3 out of 100 suffering from depression, phobia, OCD, PTSD, and particularly now we are learning more. Post-COVID PTSD is now well known because people are isolated for a long time. People have business shut down, economic shut down. So there is post-COVID PTSD. Now, if you can focus on yoga breathing and you can get a state of calmness, which we have just experienced in part, what Beatrice has shown, but there are various other ways. Your thoughts are melting away. Depression is decreased, mood swings are decreased, anger and outburst decrease, and that's a proven scientific fact. The third part is spiritual health, which is we saw that you can connect together, and what we are doing is healing on earth, is we are collecting our thoughts on to the rest of the world, global. And this global summit is so that we all pray together to give a better healing to all people on earth, those people who can afford or those who cannot afford, those who are in developed country, those who are in developed country. And we all feel light and happy, and we have better acceptance of ourselves, deeper understanding of our purpose of life. Just earning money is not the purpose of life. The purpose of life is to do something for others and feel happy, and better commitment towards both personal and professional life. Now, looking at the physiology, decrease oxygen consumption, decrease the respiratory rate, so we become calm, easy, decrease the heart rate, decrease blood pressure, decrease anxiety, decrease muscle tension, better concentration, and better utilization of nutrients by the cells. And there is proven scientific fact of increased serotonin, which is a mood elevator. It improves the behavior and it reduces the negative neurotransmitters. And we know that it also proved to have immune function improvement, kills the bacteria, kills the virus, and even kill the cancer cells on a regular prolonged use. So what is the science and evidence for this? So let's go through a few things. There are plenty of trials done. Reduction in stress is definitely, there are plenty of trials, but they have found that if 3 months yoga program clearly improved the levels of the cortisol, and therefore reduced level of cortisol, which is a stress hormone. They have reduced anxiety score, reduced stress, reduced fatigue, and reduced depression. When they looked into the anxiety status and PTSD, after 10 weeks treatment, 52% participants showed improvement. When they were looking at other disorders like depression, there is definite decrease in the levels of depression, and there is complete change in the neurotransmitter profile which is associated with the depression. In a cross-controlled trial where 218 participants were divided into two aspects, those who were having inflammation prior existing, but also there is stress produced by vigorous strenuous exercise, they have found that the yoga group had lower level of inflammatory markers. That actually is a very, very important scientific proof. Looking into the heart disease, there is decrease by regular use of yoga, the incidence of the heart attacks, and also change in the coronary artery diameter, decrease cholesterol. And that's very, very powerful scientific, and that happened as many as 47% of the cases. There is also decrease in the chronic pain, and we know backache, joint pain, chronic arthritis, carpal tunnel syndrome, all have been proven through multiple scientific trials to show the benefit. Coming to the flexibility, there is a randomly designed 66 elderly patients. So this is people who are 60 plus. They found that there is increase in the joint surface, increase in the cartilage, decrease in the surface rigidity of the ligaments, and increase elasticity of the joints, and flexibility of the spine as well as all other joints increase, and decrease in the joint pain. Improved breathing is what is very, very, very classic, and the scientific 287 clicks 15-week class regular yoga, increase in the vital capacity, increase in the total lung capacity, increase in the total ability to resist the external pollutants, decrease in the respiratory allergy, and also increase in the IgS secretion, which fight against any bacterial virus that goes into respiratory tract. Migraine also had a significant improvement on regular use of yoga. So I think that's really, really powerful to show us how does it do. Now, cellular toxins are clearly removed, and that actually helps a lot, decreasing the blood pressure, increasing blood pressure, and that is what is taxing the heart. So I think it's like anything else. Compared to the vigorous exercise that you do in gym, this is a light, gentle exercise and a lot more powerful. It does not cause any injury to the ligaments or the bone, and that is long lasting effect. You can do sitting at home, doing anything. So there are lots of different types of poses we can use. I would probably say a few of these are my favorite. But before going there, I would just mention that there is neuroplasticity, which is developed through the yoga, and that is a new advancement which is coming out. Ability of our brain to remodel ourselves in response to the circumstances, and there is down regulation of the negative pathways, and there is change, adaptation, and improvement. And I think that's very, very, very useful. And I think I would probably just mention briefly what is important here, that in the coronavirus or COVID-19, cytokine storm is the most important part that causes severe respiratory illness. And yoga regularly, through the improvement in the natural killer cells and clearing of the secretion through the deep breathing, is definitely going to be helpful. Three important poses: Trikonasana, Nokasana, and tree pose. What is the very, very valuable Cobra pose, Bhujangasana, or the Swanasana or dog pose, and then the Paschimottanasana, which is very, very good. Bastrika, which is 2.5 second deep breath in, deep breath out, is quite powerful. And that's very, very useful and found extremely useful in wiping out the coronavirus particles and also increasing the immunity. Kapalbhati is my favorite. I don't know if people are good. I think I would probably want to go if you got time. Just it's deep breath in, and then every second you breathe out. So just do for like half a minute with us. Deep breath in. So something like that, that is found to be very, very powerful doing that. And I think it's very, very good to do Anulom Vilom, which is like deep breath through the left nostril, and then you breathe out through the right nostril, and then you keep alternating through the Nadi Shodhan, and that balances your moon and the sun, which is like cold and hot in theory. And in the yoga terms, it's called Nadi Shodhan for your Sushumna is your neutral one, and Ida is your one, and Pingala is the other one. So left and right, left Ida, right Pingala are balanced. So just we are coming to nearly the end here. So what we need to do for corona control: distancing, very, very, very important. Mask whenever possible. Third, hand wash. And fourth, yoga. These, in my view, are four pillars of preventing resurgence and having the corona in full control. So if we all work together, we can win it. And even if we not kill corona, we can win corona. I think I would want to pause here, and then if opportunity is there, we can try and see what else we need to do. So I will probably go back there. If there is a time, then we can try and work around doing what we need to do in terms of a little bit more of Kapalbhati and Anulom Vilom. But if there's no time, I think I would be happy to take questions. Back to you, Prash. Thank you very much once again.
Thank you, Dr. Rajiv. Excellent information shared from your abundant experience. There is so much that we could cover in these sessions, and obviously, we want to try and do justice to all the experts who have joined us here. There are a couple of questions, if I may, I'd like to run past with you while we still have a few minutes, if I may. Firstly, and this could go into a long one, but just like the gist, how did you overcome those challenges and difficult times while integrating yoga, which is, of course, undeniably the oldest science of personal wellness and health in the world, integrating that into the contemporary medical practice, especially with busy doctors and those who are skeptics?
It's a very good question, and thank you, Prash, for bringing it. It has been a very difficult task because our medical science actually drives us in a very, very different way. And just for us to accept that is difficult. However, what I thought is I need to experimented, and I have done a lot of work and looking through so much of scientific literature and removing what was a flimsy literature to focus on very strong scientific literature, and then trying myself. I do yoga myself on a regular basis and have done it for now many years. My wife does every day 1 hour in morning, and she also managed to do another hour in the evening, and she has found decrease. I use it in my clinical practice. I do weight management clinic, and even in girl children like 14, 15 years, they have lost 1 stone, 2 stone, 2 kilos, 6 kilograms. And that is very powerful to really make me believe that yes, we can use it. A child come with asthma, I have given him some techniques. Then at the end, he was saying that, oh, he's on antidepressant. Now, next thing I heard was his psychiatrist rings me that, oh, you have seen this patient. I thought, oh, I'm in trouble. I'm not a, I'm not a mental health doctor, but with the techniques I have told, this guy has stopped taking antidepressant and he's more happy than ever before. And then this psychiatrist rang me to say, thank you so much. I don't know what you have done, but whatever you've done has worked. So these things actually helped me to give that confidence to use more and more into my medical science. And now in my day-to-day clinical practice, people are where they're finding difficult cases, they send it to me and I use both. So I say that you don't use only one thing, use a combination, and that's actually the best thing, and that's the integration what we are aiming for.
Yeah,
Getting
I
best.
could, I couldn't. Thank you so much for that genuine answer. There are, it is, it is a difficult time where we have faced in the Western world hundreds of years of Hippocratic allopathic practices that have grown and been reinforced year after year, decade after decade, and who have not had the exposure to the vast knowledge that's in the East in these holistic practices and that look at the root cause, the mur, and not just trying to treat the symptom but find the cause and treat that. And it's heartwarming that great scholars and passionate practitioners of both disciplines, who are rare, like yourself, would make the personal sacrifices despite all the challenges and resistance to continue to spread this. And it's heartwarming to see that it's actually working. People are waking up. My partner is also a master Reiki practitioner. She has been asked by the NHS to offer Reiki, and this was happening way before COVID. As far back as 5 years ago, Reiki was becoming something, an energy practice that was becoming acceptable, energy healing within the medical sphere. Cognitive behavioral therapy, even NLP, which is based on nothing more than Vedantic principles tweaked around by Bandler and his friend. All of these have now started to find avenues. And I think, as usual, the old English saying of packaging old wine in new bottles comes to my mind, at least, Dr. Rajiv. Sometimes when you package the ancient science in modern language like well-being, when you package spirituality and Sanatan Dharam and Shuddhgnan in mindfulness and meditation and self-growth, it's just a lot more palatable in the Western world. So I want to acknowledge all the great work that you're doing in spreading this and expanding the narrative and the minds of the medical community, not just in the UK, but abroad as well. On behalf of Healing Our Earth, thank you so much.